Good evening and welcome to the November community meeting of the Queen Village Neighbors Association. I'm Eleanor Ingersoll, Association President. Tonight, Dr. Kathleen Sullivan, Chief of Allergy and Immunology at the Children's Hospital of Philadelphia, is here to explain restriction goals for our first pandemic winter, as well as expectations for rolling out the vaccine to the public. Her specialty focuses on new and rare immunodeficiencies. Also, Deputy Police Commissioner Joel Dales will discuss how police are addressing the problem of reckless ATV and dirt bike riders. He heads the police detail dedicated to confiscating ATVs and dirt bikes. We welcome your questions in the Q&A option, and comments can be shared in the chat. I invite you to stick around also for the final announcement. The Queen Village Neighborhood Association elections, normally held at the November community meeting, have instead been open for the last 10 days at the office. Pandemic restrictions. Like the nation, we had record turnout this year. Thank you to all that voted. Those votes are being tabulated now, and the 21-22 slate will be announced by Board Secretary Tom Bonney at the end of the meeting. So now we begin with Dr. Sullivan. Dr. Sullivan, while there is good news today as Pfizer completed its coronavirus vaccine trial, reporting 94 to 95% effectiveness, especially with older adults, reported coronavirus cases continue to skyrocket. Philadelphia has reapplied restrictions on social and business gatherings, which continue to add to the pandemic fatigue, economic anxiety, and vaccine confusion. Can you start by explaining how the virus works?
I can. Eleanor, I'm going to share my screen. I have a few slides. This isn't meant to be a lecture, but just some of the concepts are, I think, better visually. So I'm going to try and share my screen. Please let me know when you've seen my slides.
Yes, you are up.
Okay, perfect. Thank you so much for cueing me. So Eleanor asked me to talk about actually quite a few aspects related to COVID-19. And what we decided to do is to have a formal presentation of about 15 minutes. It's not very long. And as I said, I want to use this because some of the aspects I think are just better portrayed visually. And then we wanted to leave a lot of time for questions and answers afterwards. So please don't feel like you're being lectured to. This is meant to be informal. I just want to lay a foundation. So the topics that I'm going to cover right now are why is winter such a risk for COVID-19? I'm going to talk about risk assessment. You probably have friends who do things very differently than you and just recognize the risks through a different lens than you do. And that can be a significant source of friction and frustration. But I want to spend most of my time about the vaccines. That's really the big news right now, other than the rising cases. And before I start, I think it's worth recognizing that there are over 1 million cases that have been reported in the US. Of those, about 1 million are in children. These are not insignificant numbers. Our country's never seen anything like this. In the 11 million cases are about 250,000 deaths. And so anytime I talk about COVID, I like to recognize the people who have lost their lives in this terrible pandemic. So let me just start with a definition because it can be quite confusing. So the name of the virus is SARS-CoV-2. And there's a picture of coronaviruses over on the right. And then I like to take a moment to recognize June Almeida. She was a high school dropout in Scotland, but went on to essentially invent the field of coronaviruses. And she's really quite a story in herself. So SARS-CoV-2 is the name of the virus, COVID-19, the name of the disease. So let's just talk about the conventional risks. So we know that in every country that's reported epidemiologic data, the single biggest risk factor for severe disease, so people that end up in the ICU, is age. And you'll see on this slide 5-fold, 13-fold, 7-fold. This is compared to an otherwise healthy 30-year-old. So age is the biggest risk factor that we know of for having severe disease. It's not the biggest risk factor for infection. The biggest risk factor for infection is hanging out with other people. This is the biggest risk factor for severe disease among those who are infected. Well, what else do we know? Obesity is the second biggest risk factor. And then there's a broad range of individual chronic medical conditions that also collectively increased risk. But you can see the magnitude of those risks is smaller than obesity and age. So the CDC has put together a pyramid to try and convey the notion that there are a broad range of mild illnesses, including those who are completely asymptomatic, and then the percentage of people with severe disease, meaning folks who end up in the ICU or intensive care unit and deaths. It's just a small part of the pyramid. Now, the numbers that you see here are overall in the United States. I'm a pediatrician. If we were to translate this pyramid for kids, it would be much more skewed towards asymptomatic and mild symptoms. So kids do get it. Kids represent about 10% of the overall fraction of people in the US who have been infected. So it's not that kids don't get infected, it's just that they're much more likely to have mild disease or to be asymptomatic. And conversely, on the other side of the spectrum are the elderly. So if I was a geriatrician, which I'm not, but if I was to recast this pyramid for the geriatric age range, it would be a much steeper pyramid because there would be more people with severe disease, and unfortunately, there would be more deaths. So this is the average across the entire United States, but the exact numbers are going to vary depending on the risk population that you live in. Well, what else contributes to risk of severe disease? This hasn't been studied specifically for SARS-CoV-2 or COVID-19, but for all other respiratory viruses that we know about, the amount of virus that you're infected with is a major driving force for severity. So what do I mean by that? So if you pick up one little virus on your finger because you touched a doorknob and then stuck your finger in your eye, that's much more likely to be a mild disease than someone who gets coughed on and gets a lot of respiratory droplets in their face and in their nose. So the amount of virus that you're infected with at the moment of infection drives severity. Okay, well, Eleanor asked me to talk about winter. You've heard a lot of talk about winter. We have to buckle down. We have to really be very careful because winter is coming. Why is it such a big deal? Why is everyone focused on winter? So there's a few reasons. It's not one thing. So just being indoors like we are all right now, the air is more constrained, and so it's more likely that you'll get a high dose of the virus. So just being indoors, which we generally are in the winter, is a risk factor because you're more likely to get a larger dose of virus. But here are two things that are maybe not that obvious. So other respiratory viruses lead to people coughing, right? We have a cold, we cough. So if you are infected with COVID-19 at the same time, and maybe you're one of the fortunate people who would have had an asymptomatic infection, but now you've got another cold virus on top of that, and so you're coughing, you become much more contagious than if you were asymptomatically infected. And then the last point is we know that around the country, people who end up in the ICU with respiratory viruses, about 10% of the time have two viruses. So we think that having two viruses at once is just a risk factor for bad outcomes and severe disease. So that's why all of these together are driving the policies about trying to mitigate disease and transmission during the winter. Okay, well, the second thing that Eleanor asked me to talk about is risk assessment. And so I have patients where they have essentially locked themselves in the house since March and don't even go out for the mail. So there are people who do that, and there are other people who blithely go line dancing every Friday night. And they're not wrong, but everyone is going to have a different way of approaching risk, right? There are people who happily bungee jump, and I would not even stand on the bridge to bungee jump. So everyone has their own perspective on risk, and we have to respect that individuality. But let me just give you a few things to hang your hat on. So masks, masks, masks. You've heard it 100 times. I know it's exhausting. I know they're uncomfortable. I know they make your glasses fog up. I get all of it. I do. But masks are really important because they prevent infection. So the infected person speaking, coughing, singing, laughing, that mask is in the way so that the virus doesn't get to the next person. They do provide some protection for the person wearing the mask as well. And this is not new. I know it's really politicized, but we have known that masks prevent infection since the 1918 influenza pandemic. So in Army barracks, they recognized that masks prevent infection and they started masking all the soldiers in the Army barracks. So this is not new information, even though it's become this very tension-filled decision that people make. Well, this is really the slide I wanted to share with you. Now, mine happens to be under my face, which makes it not very useful, but the concept, I love this graphic from the Texas Medical Association. It tries to sort of stratify different life activities, like going out for mail versus going to a bar, playing tennis versus playing soccer. So it tries to sort of stratify the risks associated with different activities of daily living. And they're not all created equal. So going out for the mail is very low risk. Going golfing, very low risk because you're not interacting with a lot of people. Now, the risks of all of these go up the higher the community spread. And right now in Philadelphia, our test positivity rate is 12%, which is higher than it's ever been at any point in the pandemic. So there's a lot of community spread of COVID right now. So the risks of all of these go up the more virus is out there in the community, but it gives you some sense of the relative risks. And I do want to say, I fully understand people are exhausted by all of this and they just want it to be over. And I promise the end is in sight. But to just give you some things, some tools to sort of get you over the winter, I do think it's important to manage stress. Stress is bad for your immune system. And I do believe in mindfulness and meditation. I also think exercise is beneficial. And I think we are a social species. Find a way to interact with your loved ones, your neighbors, your friends. Otherwise, it will just make us all completely crazy. So I do recognize that. Just find a way to do it safely. Go for a walk and stay socially distant. Use Zoom. Just try and do it in a safe way. Okay, but I know everyone wants to know about vaccines, so I'm going to dive right in. So there are 213 different vaccines at various stages in development. There has never been this much effort dedicated to the eradication of a single disease, including AIDS, and there have been billions of dollars spent trying to develop a vaccine for AIDS. But COVID-19 has spurred tremendous efforts to develop a vaccine. And I'll just remind you that vaccine development is a process. It's not you just wake up one day and have a vaccine. So preclinical means in a test tube. Phase 1 is just injecting a few people just to make sure that nothing terrible happens when you do that. Phase 2 is a little bit more about safety. And phase 3, which is what you've been hearing about in the news, is where we identify efficacy. So you vaccinate a lot of people and you let them go lead their lives, and some of them will get infected and some of them will be protected. And you tally all those numbers up at the end of the phase 3 component and you ask, was the vaccine effective at preventing disease? Amazingly, and even as an immunologist, I am stunned by the efficacy of the Pfizer and Moderna vaccines. They are 90 to 95% effective at preventing disease. That is amazing. That is on par with the measles vaccine, which is one of the most effective vaccines in our history. I will just compare that to the influenza vaccine that many of us get every year, which is in the neighborhood of about 50% effective. Now, I do want to say that even after a vaccine is licensed, there's still collection of safety data that happens. And so adverse events that might take months to show up will still be collected in this post-marketing phase. Okay, so there's tons of vaccines, 213. Let's just talk about the front runners. The two that are in the news are Pfizer and Moderna. They are both made the same way, and I'll spend a moment talking about that. Over on the right of this little pictograph here, I've just listed the different types of vaccines. So all of us on this webinar have had, probably in our lives, many different types of vaccine. Polio, we've had the measles, mumps, rubella, we've had the pneumonia shot, maybe some of us have had the shingles shot. So there are different vaccines and they're different types, meaning there are different ways of generating an immune response to the thing that you're vaccinating to. What's fascinating about Moderna and Pfizer vaccines are that they are messenger RNA. This is not a mechanism that's ever been tested in the human population at this scale before. And I will say a word about what mRNA vaccines are in a moment, but let me just move on to sort of the practical bits right now. So people always want to know what the risks are. So the adverse events have not actually been reported. That will happen when they submit their application to the FDA, which will happen very soon. But in the phase 1 studies, which have been publicly reported, the side effects were sore arm and fever. We don't know the rates, that hasn't been reported. But in anecdotes from people that got the vaccine, it seems like it's pretty comparable to the shingles vaccine. So probably some people on this webinar have had it. You maybe had a sore arm or a little low-grade fever. And the question I always get asked is, can I get COVID from this vaccine? And the answer is no, no, big capital letters, no. So what is this vaccine? So I have this super corny audiovisual aid that I'm going to share with you. Got it? So this is the COVID vaccine. This is not what is being injected into people. This is the spike protein. So these little things that decorate it, that make it look like a crayon, this is not being injected into people. So the polio vaccine, the Salk vaccine, is a whole virus. If you got the pneumonia shot, you got a piece of the pneumonia bacteria, that's this. That's not what either of these are. These are the instructions to have our own bodies make some of this protein, and then our immune system responds and make antibodies. So you cannot get the disease from the vaccine. How will it be provided? There's been a lot of anxiety about that. There's never been a vaccination effort of this magnitude. And you probably know the Pfizer vaccine has to be stored in these super expensive freezers. But there is a way to roll out these vaccines through local pharmacies. That won't be the first way it happens, but they can store the vaccines at many local pharmacies. The first wave will likely be delivered to clinics and hospitals. And the reason for that is that the first group to get the vaccine will be healthcare workers. After that are essential workers and people that are over a certain age. There have been different ages that have been proposed. So it's in red in this slide because that piece hasn't been decided yet. And what's really lovely is they included essential workers, people like grocery store workers, people who pump gas, people who are really essential to the functioning of our society that I think sometimes are a bit neglected. So people like that were included in this first tier, which I think is really important. But here's where the rubber meets the road. Tier 2 is completely undefined. So it is meant for vulnerable people, not the general population, but we don't know who will be included in that. So there's a lot of, as you can imagine, negotiating that's going on behind the scenes. So until then, what about schools? So school's so controversial. And I was just on another webinar that was talking about schools and school transmission. So kids don't infect adults very often. So that's not the issue here. The issue is that to run a school, to make it happen, you also are bringing together adults, and that adult to adult transmission can be quite high. It's indoors, it's constrained. And so the teachers, the staff, the bus drivers, all of the people that make a school function, that's the real issue here. So I'm not coming down on one side or another. It's a super hard equation. You want to protect people, but you also want to give kids a chance to learn. I don't envy the people who made that decision. So in summary, be patient, be safe. We're only talking about a few more months before most people will have access to a vaccine. I promise the vaccines are coming. So do be safe through the winter, make good decisions, and assess your risks before any get-together. So I'm going to stop, and I think Eleanor has some questions. Oh, sorry. I did want to give you, I think the slides are going to be available, and I'm happy to give these links. these are ways that you can look at your specific city, your specific area, even down to zip code, and look at the prevalence levels. Okay, now I'm going to stop sharing my screen.
Excellent. Thank you so much, Dr. Sullivan. There was even more information than I expected, and I'm curious to see if we have any questions, and we do not yet. But what is the realistic expectation for access to the vaccine in your that, not that you will be rolling it out, but from your experience and the information and discussions you've been having?
Yeah, it's incredible how much vaccine has been produced so rapidly. So if we look just at the two vaccines that seem on the verge of being approved, which are the Moderna and the Pfizer vaccines, they have each pledged to deliver 20 million vaccines upfront for healthcare workers. There's about 20 million healthcare workers in the US, so we've already got those folks covered. If you add on essential workers, that's probably another 20 million. So we've got that group covered. Both of them have also said they can deliver approximately 20 million a month thereafter. So that nebulous tier 2 group that consists of vulnerable individuals that have yet to be articulated, that's probably another 40 to 50 million people, depending on how they define it. So that's by February, and then it gets rolled out to the general population. So you would expect that most people who want it will be able to get it by May or June.
That's actually quite remarkable, considering it was identified and the lockdowns began in March, more or less, to have it just over a year being able to inoculate like the population at large. That is very, very amazing. We have a good question here from Brian Reedy. I hope I pronounced that correctly. How do you feel that face shields provide significant added benefit? And I do hear a lot of opinions about that.
Yep, absolutely. So at my hospital where we work, we wear some kind of eye protection in addition to a surgical mask before we see a patient. And the data do demonstrate that having some barrier in front of your eyes does contribute to prevention of disease. So absolutely.
So the full plastic one that comes down, whether it's worn from the forehead down or if it's resting on the collarbone up, that is good. That is.
So it doesn't matter what conformation it takes. So if you're wearing a regular mask that covers your nose and mouth, the only portal for infection at that point is your eye. And so having something over your eyes, either eye goggles or a full face shield, either one protects your eyes.
I see. I see. And on the heels of that, which can probably be what you've explained before, Matt Atkins asks if it's safe to ride SEPTA.
So I ride SEPTA. I hope it's safe, but I am careful. I have to say, when I've been on the bus that I usually take, people have been super respectful about sitting every other seat and wearing masks. I haven't seen people not wearing masks, so I feel quite comfortable. I know that's not the case everywhere, and I have friends who've said they've seen otherwise. I feel okay riding SEPTA, but boy, do I Purell afterwards. And I'm very conscious on the bus that I don't touch myself at all.
The question from Tammy J, and I'm not sure if this is something you can answer. What about the cost of vaccine for insured and those not insured?
Yeah, Tammy, that's actually a really important question. The finances of this rollout are completely up in the air, and there's lots of controversy. The states are being asked to bear the burden, and there's finger pointing, and there's politics, which is just sadly where we find ourselves in 2020. I guarantee that they will find a way to deliver it. I do think insurance companies will be asked to pay for the vaccine, but I also think that there will be state programs to provide it for people who don't have insurance or who otherwise can't afford it. So I think the public health mandate is so great that the states will absolutely find a way to get the vaccine into people willing to take it.
Excellent. Jean Myers says that she suffered a severe reaction to the shingles vaccine. Can that same reaction be expected with this? Are there any reports of any reactions from
So for
the
the
pilots?
yes, so you might be referencing that there were two vaccine studies that were put on hold. They were paused. Those were both a very different platform. So they used a virus to make to I just have to use my little audiovisual aid one more time. So they used a virus to make this spike protein. Those platforms are actually being used right now in Russia and China. You might be surprised to learn that there are two countries that have already rolled out vaccine programs. They're not reporting a lot of adverse events, but it's Russia and China. They tend not to do that. So if you're worried about the two studies where they had adverse events and the studies got put on hold, that's a completely different platform. The Moderna and Pfizer vaccines to date, the only adverse events that have been reported are sore arm and mild low-grade fever. None of them were severe. So having an adverse event to a different vaccine using a different platform would not in any way predict that you would have the same thing from this. It's a completely different way of vaccinating people.
John Bang asks, will the vaccine be annual like the flu shot or every couple of years? Is that foreseen yet?
No. And both companies have said they don't know the answer to that yet. They will be following up the volunteers that participated in the study. I will say, just because the actual infection doesn't seem to induce long-lived immunity, that doesn't mean the vaccine can't be better. There are plenty of examples where immunity to a vaccine is better than immunity to the actual infection. And so I think we're just not going to know until they follow people over time.
Okay. And Mike Seidenberg asks, what are the current recommendations to best treat those ill? And I'm guessing those infected, probably especially if it's a family member.
Um, so it depends on the severity of the illness. So for people that are walking and talking and not having trouble breathing, we don't usually treat them. Um, for people that are in the ICU, clearly we provide abundant treatment. You might be referencing the one drug that is meant to treat the viral infection, and that's remdesivir. It does work, but it has a relatively modest effect. So it's not like taking penicillin for strep throat. It's not that effective, but it does seem to mitigate the infection somewhat. So other than that, the care is supportive. And for people that are extremely ill, that supportive care is hugely important.
Thank you. And it is important to note too, and maybe even especially with children, that if there's a fear or a documented possibility that they've been exposed, is it true that they are asking, most places are asking people to wait 7 days to see if there are symptoms before a test is applied?
But 5 to 7 days. So if you, let's say, you're having a party right now as you're listening to this webinar, and you think you might have had an exposure, don't get tested tomorrow. That's too soon. There's not, we can't detect the virus that early. So the peak time for detecting the virus is 5 to 7 days after the infection. And so that's the peak time.
And on top of that, the various tests. There is the what's been described as kind of like a brain probe test, and then there's one that's lesser of but still nasal entered test. But then there's also the scraping of the mouth. How effective are they all in comparison to each other? And what what should people expect or aim for? Or is it just whatever test is applied at the site you're going to?
So there's huge differences in the tests, and they actually demonstrate different things. So the gold standard for sure is having the probe up your nose. And no, it's not pleasant. It does feel like there's, it's like having a dentist drill all the way up your nose. So it's not pleasant, but it's the best way to establish infection. The ones where you either spit or you swab something in your mouth, those have an important advantage. They're an instant readout. So it's like a pregnancy test. So it's that technology, but they're not very accurate. They're great for population screening, and they will surely improve over time. And I can see where they might be used to allow visitors to assisted living facilities or something like that. So I do think there will be an important role for them, but they're not so great diagnosing one patient in time. So they're okay, but they're not great.
Um, Karen Plaquette asks if the protection by the vaccine is short-lived, has there been a discussion whether to give priority to revaccine tier 1 personnel rather than rolling it out to tier 2 and the general public? These are some really fantastic questions. Thank you, everybody.
They're pretty sophisticated. So the data from both Pfizer and Moderna suggests that the antibody lasts at least 3 months after vaccination. So I think the bigger question is, does it last for a year? Or does it last for 5 years? But it lasts for at least 3 months. So we're not going to have to weigh revaccination this season. I think the question's going to come up next fall, probably, whether immunity has waned and we need to revaccinate people. So it's not an issue at the moment.
I'm trying to keep up with these. We've got some, I'm listening to your information and trying to keep up with these really fantastic questions. What's from Malcolm Mark, what percentage of individuals in the population will need to be vaccinated for reasonable immunity in the community, since many individuals are likely not going to be vaccinated? Will we need to continue wearing masks even after vaccination?
Yeah, Michael, that's like the $9 million question. So we don't know what, so for each virus that has ever been studied, be it chickenpox, mumps, measles, you name it, any respiratory spread virus has its own level of herd immunity. So generally, just to give you an idea, generally herd immunity is in the range of 80 to 95% immune before you really get genuine herd immunity. But that doesn't mean that we will necessarily be requiring masks for the next decade. I think we don't know enough about how this virus behaves. As Eleanor pointed out, we didn't even know this virus existed a year ago. So while true herd immunity generally takes quite high levels of immunity in the population, I wouldn't be too sure that that necessarily means we're going to have to wear masks and carry around Purell everywhere we go for the next decade. So let's wait and see.
Amanda Robinson wanted to follow up about the tests, and she asked, what are those less invasive tests called if a testing location gives an option? And with that, do testing places give options, or do they make the decision for the patient?
All of the drive-throughs and the city-sponsored sites that I know about are doing the nasal probe. So the rapid tests are called antigen tests or rapid tests. They're instant. They're not mistakable. So you would never confuse the two. I don't know any sites that are offering both, but at a hospital, they could potentially offer both. As far as I know, none of the major hospitals in Philadelphia are offering the rapid spit test. And the reason is that it's not as accurate diagnostically compared to the probe up the nose.
Excellent. And we've got one more follow-up from Tammy J here. What are the potential risks for later reactions of the vaccine for people who suffer from other chronic issues? Because this is being pushed quicker than other vaccines, as someone who suffers from multiple chronic health issues, she's concerned about things that are discovered later on about the vaccine.
Yeah, that's the whole point of the post-marketing surveillance. So for people like you that have some reservations, you might choose not to get it in the first wave. You might choose to wait. There's just no way to know until enough people have been vaccinated with chronic conditions, whether there might be some subgroup that doesn't do particularly well with the vaccine. And so they did a pretty amazing job. So in this 3,000 people that each company vaccinated, they tried to be really mindful and include a lot of age ranges, include some people with disease, which normally would not be a part of a phase 3 study. And they also were really mindful about racial disparities, and they were careful to include people of different racial backgrounds. So they tried really hard to take a slice of America in their study. But having said that, we're not going to know about small subgroups of the population until enough folks have gotten vaccinated that there's data. So I don't have a great answer for you.
Well, Dr. Sullivan, it looks like our questions have come to a close. This has been incredibly informative from both by you and by the community asking the questions. The good thing is this is being recorded and it will be posted on our website so people can go back and review information, because there was a lot of good stuff here. And I really hope that you'll come back and join us in a couple of months so we can follow up with the rollout and new things that are learned as more studies are coming up to fruition.
My pleasure.
Thank you. And now for the second half of our community meeting, I want to welcome the very patient Deputy Commissioner Joel Dales. He is we were talking about fatigue early on with the pandemic and the restrictions and the anxieties. But there's also a bit of fatigue around the road packs of dirt bikes, ATVs, and motorcycles. Because as we've all been hearing, and it's not unique here, it is happening across the city. There's no shortage of accounts about near accidents for pedestrians on sidewalks, unsafe and wrong way driving of driving around cars and people, plus the constant stream of revving engines till the early morning hours. And I'm talking about ATVs, dirt bikes, and sometimes motorcycles. The police have been very proactive in addressing this, and as of October of this year, have confiscated 370 ATVs and dirt bikes. But they're also navigating constraints like budget cuts and manpower focus on gun violence and protests, which prohibit the program to seize the ATVs and dirt bikes. It cannot be a daily program, a daily detail. Commissioner Dales, we all know that it's illegal to ride ATVs and dirt bikes on city streets, but police have a no chase policy citing safety. Unfortunately, the residents, the communities may see this lack of enforcement as giving free rein to riders. So can you help the community understand the reality of managing this chronic situation?
Yes, well, thanks again. I appreciate you for inviting me to speak this evening. So due to numerous complaints of illegal ATVs and dirt bikes being driven through our city, we put together a ATV detail, which we ran it more frequently this year and opposed to last year. As a result of that, I'm going to increase the numbers that you gave, which is great. We actually ran the detail for 16 days this year. Last year, we ran it for 12 days. As a result of running this detail, the detail in itself confiscated 302 ATVs and dirt bikes combined. In addition to officers on routine patrol confiscated 108. So the total for 2020 is 410 ATVs and dirt bikes we've confiscated this year. It is challenging to run this ATV detail on a daily basis. I wish I could, but due to what you mentioned, some of the constraints that we're faced with, is making it hard for us to run this detail on a daily basis. The biggest issue is our budget cuts. This year, our budget was reduced by $33 million, which affects our staffing for the detail. And also too, we, in reference to our police academy classes, our department is only able to graduate a small amount of officers this year, a significant amount at that. So these are some of the issues that we are facing. The ATV detail does require paying officers overtime, which can be costly, I will say. But we're going to continue to do our part and continue to enforce the law on our end. I know we have a lot of questions, so I'm going to save the remainder of my time for Q&A, unless you have other
And
questions.
I just wanted to, before we get to the questions, and I should mention that you said before we went live that you were having problems with your camera, or
Yeah.
we would be seeing you. So I just want to make sure that was understood. I guess how do the police decide? How do you decide where you are going to focus a detail for confiscation? Because as we know, it's happening up in the Northeast. It's very much on Broad Street. We know it's around Queen Village, Pennsport, Society Hill, Old City. How do you track it to determine which place will get the detail?
So first and foremost, the complaints from the community. We receive numerous complaints via tip line, emails, also from the district captains who are experiencing high level ATVs and dirt bikes in their respective districts. Police personal observations, they share that information with us as well. And also our aviation unit, when they're up in the air, they notice that certain parts of the city, a lot of ATV riders and dirt bike riders tend to congregate in certain parts of our city. So that's how we pretty much track and gauge where we want to focus our enforcement throughout the city.
So what would you have the community at large do? Is it best to log complaints with the captain of their particular district, to go through councilman, to what is the best way for you to receive? Because it sounds like there's a plethora of options.
Yes.
What would be the most effective to tell the people who are joining us tonight?
So the best way to do it is, one, you can visit our website, which is phillypolice.com. You also can submit a tip via phone by dialing 215-686-TIPS. And also you can also email your tips to, I believe it's tips@phillypolice.com. You also mentioned your district captains or your community relations officer. You can bring it to their attention. They'll bring it to our attention, where these ATVs are being ridden illegally and the activities they are actually doing out there within our certain parts of the city.
And is the police department taking a position on this proposal that's still very much in its nascent stage of having an ATV dirt bike park designated somewhere in the city at some future time? Councilman Dom seems to be interested in that.
So our department, we're neither opposing or supporting the idea of creating a bike park at this time. So I'll leave it at that.
Very fair, very fair. So I'm going to get us to some of the questions we have here. And I see there are comments, but I'm going to go to questions. Malcolm Mark asks, what happens to the confiscated bikes? Are they returned to their owner?
So it depends. So now we are confiscating well, actually several types of illegal vehicles from the streets. You got ATVs, you have dirt bikes, you have scooters, you have mini bikes, etc. But the ATVs in itself, the way that works is we confiscate the ATVs, and what helped us out tremendously is the city ordinance, which allow us to issue a $2,000 ticket to the rider. Once we confiscate the ATV, we take it to our impound lot. Now, in order to get the ATV back, they have to go through what we call it's like a somewhat of a hearing, the Office of Administrative Review. They make the decision whether or not they will return the ATV, which usually they won't, because you cannot ride an ATV in the city of Philadelphia. It's illegal. They must produce a title, registration, identification, proof of insurance. They must pay the fines and fees. And if they actually complete all that, they have to go through the hearing. Once the Office of Administrative Review, if they say, okay, we can return that ATV to that person, then they will contact our impound lot, which they would submit a release order. Then we would give it back to the owner. If they can't reclaim their vehicle, then we will just have that vehicle destroyed. Now, the dirt bikes are different. Dirt bikes are illegal, but it's easier to get the dirt bikes back based on the way the current law exists. We pretty much confiscate the dirt bikes through our livestock program, which if the rider doesn't have a license, if the license is suspended, if the vehicle is not registered, or if the registration is suspended, then we can actually live stop that vehicle and impound it. And all it takes for them is to produce a title, registration, identification, proof of insurance, and pay the fines and fees. And then usually that dirt bike is returned to the owner.
But it does sound like there are quite a bit of hoops to jump through to accomplish that.
Yes, and I must add that I also noticing an increase of dirt bikes opposed to ATVs on our streets. So that's the biggest issue, are these dirt bikes.
Karen Plaquette asks, does the detail focus on vehicles with noise disturbance or also on wheelie kids?
So pretty much we focus on illegal vehicles on our streets, dirt bikes, ATVs, mini bikes. So we pretty much focus on that. As far as the noise wise, not really. We just pretty much focus on their behavior and also the physical characteristics of that vehicle. When I'm meaning dirt bikes.
Al Cavallari asks, if some 300 vehicles and dirt bikes and ATVs were confiscated, that must mean some 300 offenders were taken into custody. How about having penalties for the riders of those vehicles that would be harsh enough to make it not worth it for people to engage in this activity? And what kind of penalties do they face?
Wait, repeat that again. Did you mention that they were taken into custody? Did you say that?
So I guess that's the question. When you confiscate an illegal ATV or a dirt bike, the rider, what happens to the rider? They're taken and charged with the penalty as well?
Well, that depends. We have made arrests. Most of the arrests are for receiving stolen property, which most of these vehicles are stolen. We actually made arrests where the riders had a firearm in their possession, narcotics, eluding the police, recklessly endangering another person, meaning the way they operate those vehicles, as far as doing wheelies and riding on the wrong side of the road, things of that nature. Then yeah, we would charge them with that. But on average, we do not take them into custody. We confiscate their vehicle, issue the citation, or whatever ticket that whatever they violate motor vehicle code, we issue that ticket for the violation, and they are set free.
Brian Reedy asks, and this is a bit of an ominous question because it has been going on for a long time. Do you think this problem is solvable? This has been going on for years. South Street is a major problem. Does the DA weigh in at all?
Well, I won't speak for the DA. I will say it is a big challenge. As you can see, we confiscated 410 ATVs this year, and we still have an issue with the ATVs and dirt bikes on our streets. So it is definitely challenging.
Especially in these difficult pandemic economic times.
Yes.
For this and every other city. John Bang asks, can the PPA, Philadelphia Parking Authority, assist in issuing tickets? If there is a noise ordinance in a certain area, how do police handle that or enforce it? Do you have decibel meters, or is it just officers' discretion?
So we do issue tickets for vehicles that loud mufflers that are extremely loud. So we do issue that, especially along the South Street corridor. That have been done in the past, but it's mainly our law enforcement, our police officers who are issuing these citations. I don't believe, as a matter of fact, Parking Authority is usually, we issue motor vehicle codes in reference to that. We can do two things. One, we got city citation or a motor vehicle code we'll issue for the loud noise within a residential area.
So have you been able to chart if this problem is affected by weather as we get into the colder temperatures? I mean, not to mention just the complete lack of nightlife due to the pandemic?
So in comparison to last year, once the weather changed, once it started getting colder, you would see less ATV and dirt bike riders on our streets. However, in 2020, it's unpredictable. All kinds of things happening this year. So I wouldn't be surprised if you continue to see a large amount of ATV riders on our streets.
Um, uh, the South Street Business District, along with the communities of Society Hill and Queen Village, have had different road closures cut off around the extended weekend hours, et cetera, to try to stave off this problem. Do you work in conjunction with those efforts to pinpoint where there might be kind of a starting spot for the dirt bikes and the ATVs?
So I'm glad you brought that up. So on South Street, the reason why they put those blockage in place is because of the fact that we would have a lot of people congregating on certain parts of South Street. So either one, you deal with the ATV issue, or two, you're going to deal with the large amount of folks hanging out on those blocks. We had several issues in the past. We had shootings in the past last year as a result of a lot of people gathering from all parts of the city and outside of the city as well. So they put the blockage in place to prevent folks from parking on those blocks and to prevent the folks who were migrating to South Street from hanging out on those little streets. Now I'm hearing that it's what is causing, and it is what's happening now is it's causing an issue where the ATVs and dirt bikes are constantly circling around South Street, going up and down the streets and coming back around down South Street again. Now it's up to the captain, it's up to the captain and the lieutenant who runs South Street, is there up to their discretion to make that adjustment. So that's something we can talk about. I don't know if the head house had a conversation with the lieutenants and captains in reference to that, but I recommend that they do so. And maybe they can make those adjustments if necessary. But again, the main reason why they put it in place was because of the fact we've been having ongoing issues along South Street with the young adults who don't get me wrong, you have some folks who, when they show up on South Street, they are orderly, but you got some folks who are disorderly. And that's what we try to prevent.
And we have been, the community's been working with the business district to see that there's closures, no parking enforced to deter the tailgating, and therefore the audience for the ATV and dirt bike show. So just to follow up on that, for the confiscation, do you work with those details, or is it all just the tip lines and the other information you get to pinpoint where the staging place is for the ATVs and dirt bikes, whether it be at a gas station or a parking lot, on the pier? How is that information come to you?
Right, so that is part of our tactic. Without going into details and reference how the detail is ran, that is one of the tactics that we use. They have to gas up, and when they do, that's when we usually confiscate a large number of ATVs and dirt bikes. We do receive information from folks from South Street, as well as the police officers and commanders. They do let us know exactly where the ATV and dirt bike riders may gas up. I don't want to go into too much details of being recorded, right? But those are some of the strategies that we use. But we are getting the information. But the problem is by the time the detail arrives to that location, they're gone. So those are some of the issues that we're facing as well.
So it's actually tips from the community over time that could actually help if you can see a pattern of where places, of regular staging places or something like that. So because another thing I'm seeing in the chat is police ignoring this behavior, and I think you've mentioned it, and maybe it deserves repeating. Why the police take certain actions or precautions that they do, what's mandated, and why?
Okay, so number one is we do have a policy in place where police officers cannot pursue ATVs, dirt bikes, etc. We do have a pursuit policy in place which prohibits us from pursuing vehicles unless we have probable cause to believe that a forcible felony was committed, meaning that they committed a robbery, pointed gun, or they're in possession of a deadly weapon. then yeah, we can pursue them for those reasons. But if we do so, we still have to use caution while doing that. We just can't pursue folks for motor vehicle code violations. We can't do that's prohibited if that stands alone. Um, the ATV riders and dirt bike riders, they know that we can't pursue them. Um, it's frustrating at times, I will say, but we have to look at the big picture. If we were to pursue these ATV riders and dirt bike riders, they would care less about who they run into, who they would injure as a result of that. And guess what? If we initiate the pursuit, who's going to be responsible? The police department, right? So I would not want to see anyone get hurt behind the fact that we initiating a pursuit trying to stop these ATVs and dirt bikes. So that's why we have certain strategies in place to confiscate these ATVs and dirt bikes. And I'm really impressed with the fact that even though we have this policy in place, these officers and supervisors, they're very creative as to how they are confiscating these vehicles. So I commend them for that. And I've experienced myself where I'm in my patrol car, well, in an unmarked car, in uniform. They see me and they'll just take off and do a wheelie. And we cannot pursue them. No, we cannot. And it's frustrating. But in the long run, eventually we'll catch them, I hope, if it's that same individual that I've seen. But they will lose their ATVs or their bikes in the future. That's the way I look at it.
Um, two more questions, and this has come up before, and I know it's a streets department decision, but maybe you could explain also why not more speed bumps or traffic calming measures? Would that help deter this activity?
No, I don't believe it won't. Um, if, actually, the ATV rides, they probably use it as to pretty much use it as a challenge for themselves. How fast can you jump over a speed bump? That's what I believe they probably would do. But I don't believe that's going to really have a big effect on where they ride these ATVs. Now I will say this: speed bumps may um, prevent them from doing wheelies, things of that nature. I guess that's my guess, because if they do it and hit a speed bump, chances are they probably will fall off the dirt bike or ATV. But overall, as far as slowing down the amount of ATVs and dirt bike riders in the community, I don't think it's going to have a big effect on that.
And to follow up on what you said, just as in pursuing these minor violations, the responsibility and any consequences on the police, just like in past conversations I've been involved in with the councilman and other agencies, is that if traffic calming measures were put in, such as speed bumps, and something did happen to someone who rode over a speed bump, the responsibility, aka the lawsuit, would be the city's. So that also the city and the streets department is reluctant to put these in for that particular resolution. There was a question here. What about licensed motorbike owners just hanging out, revving their engines every time a lady walks by? But then again, you can't readily tell off the top if that's registered or not, correct?
We will have to check. We have to run the tags and get their information and see if it's valid or not. So, and as far as revving the motors to get the female's attention, by the time we get there, I'm sure they would stop. So
Exactly. And we have covered the bulk of the questions asked. There were a lot. They were great. I definitely hope I got to yours. If I didn't, I'm going to give you this opportunity to put it in while I say to Deputy Commissioner Dales, we will put out the information, because it sounds like the most important thing that the community can do right now is take advantage of giving the police as many tips as possible, not so much for immediate action, but to create a pattern or a picture and data, so you could see patterns of where this is happening, where it might be originating, and where to focus officers. Is
yes,
that correct?
That's correct. That's very helpful because, like you mentioned earlier, as far as staging areas, there may be locations we may not be aware of, because usually what these bike riders do, they will meet somewhere. Like, for example, they will meet in East Division, like at 9th and Hunting Park. They will meet there, then head downtown to the downtown area. Usually we have intervene and confiscate the vehicles before they even reach the center city section of Philadelphia. So little things like that definitely helps. If you know locations where they're staging, or areas where they're hiding their ATVs, send us a tip. We can investigate that.
Fantastic. And I'm just going to double check because I think a couple came in here. Um, oh, Karen Plaquette asked me about what if there was an annual event or parade per se for Karen. I'm trying to find your comments. Oh, I think it is. What about the option of a once a month ATV dirt bike event parade with a police escort to allow the activity with some safety built in?
So I can share an experience in reference to that. So there was a funeral in East Division, and a couple of dirt bike riders asked, "Please, can you let us pay our respects by letting us ride as a group with our ATVs and dirt bikes?" I mean, it was over 100 of them out there. Well, 100 of them they were threatened to have 100 ATV and dirt bike riders show up. So we met them halfway. We said, "Okay, listen, we will let you gather and pay your respects. We will have an escort, but you have to promise us that once it's over, everyone will go home. You will leave the area, and you will be very respectful." Okay. So as a result of that, some listened and some didn't. Half did not. Right. And then there's an annual event where there was a dirt bike rider who was killed several years ago. So what they tend to do, they tend to gather and ride throughout the city, um, in remembrance of the ATV rider or the dirt bike rider who was killed several years ago. So I don't think it's a good idea, because what that is attracting ATV riders and dirt bike riders to come to our city. And just because they may be together for that one event, guess what? Once the event is over, they still want to have fun. So they will take it elsewhere citywide.
That's a very good point, and that's why with every action there is an equal and opposite reaction, and it's important to remember that applies to ATV gatherings and whatnot.
Mm-hmm.
I do think we've gotten everything covered. Deputy Commissioner Dales, thank you so much for joining us. I hope we'll be able to connect with you again in the spring, and we will keep our fingers crossed for a quiet winter and continue to push making reports and tips through the various outlets that you mentioned, which I'll confirm with you later.
Yes. You want me to repeat them again?
You know what? I'm actually going to get them from you, and then I can post them in our newsletter and on our website, so everybody has access to them.
So I'll put it in the chat. Yep, that'll work.
Perfect. Even better. See, two minds are better than one. So I thank you. While Deputy Commissioner Dales is putting that information to the chat for everybody, which we will also make available later, I want to bring in QVNA Treasurer Tom Bonney, who is going to give us the results of the QVNA elections and the numbers on this year's voter turnout. Tom.
Awesome. Thanks, Eleanor, and good evening to everybody. First off, I'd like to thank the nominating committee chaired by Carolyn Allen, with members Marion Blow, David O'Donnell, and Maria Frizzell Roberts. So thank those of you for your service in running the election this year. We did have, I think it's probably pretty close to a record of 203 votes cast this year, Eleanor, which is a substantial increase over the prior years. In addition, I wanted to acknowledge and thank all those who did participate and submit their names for the offices. So for the board, we had Khalid Ali, Kate Allen, Matt Atkins, Joe Brin, Anita Brooke Dupre, Michelle Grimley, Mike McFilmy, and Mike Seidenberg for the director role. So for that crew and that team, thank you for your commitment to the community and your interest in getting involved. And to Eleanor, thank you again for running for our president, and Justin Fishman for our vice president. Both Eleanor and Justin ran unopposed. So as I segue into the results, Eleanor and Justin have been elected overwhelmingly. So for the 5 director roles that we had, the winners for the 2021 and 22 term are Kate Allen, Matt Atkins, Joe Brin, Michelle Grimley, and Mike McPhilmy. So that will be our slate going into the next couple of years. And so those folks will hear from Lucy over the next couple of days with some coordinating details. And again, I want to thank the nominating committee and all of those who chose to run for the Queen Village Neighborhood Association board and officer roles. We very much appreciate the commitment of your time to the community and to help to create some unbelievable programs like the ones that we've had tonight. So Eleanor, there you go. Back to you.
Tom Bonney, Treasurer, thank you so much for that. I want to echo Tom in thanking all the candidates for coming out and showing their commitment to the community. Thank you to all the voters that came out. 200 plus votes is a record. So I guess the pandemic and our electronic outreach has its pluses, but this really shows some great community investment on all sides. And I thank you all so much. Congratulations to this slate of the 21-22 term. And remember that this information, this meeting will be on our website. So you can refer back to anything about our pandemic conversation, as well as our ATV and dirt bike conversation. And we will definitely circle back around on those in the new year. Again, thank you for joining us tonight. It's been a pleasure, and we'll see you next time.